the Health 2.0 conference. How are we doing today? Sleeping. All right, we got one guy who's really happy. Fantastic. All right, so I'm not sure what happened last night, that everyone's overslept. Maybe we emphasized too much that sleep was really important. And to release some dopamine in the morning, I'm going to start the day by saying, I love you. Yes? Aw, I know, see? Instant smiles across the room, instant dopamine right there. All right, so we have people from every corner of the globe, and we are starting our Day 2 conference. It's filled with amazing panel discussions and fire chats, bound to get some debates bouncing around. It's going to be great. And I would further like to extend our heartfelt thanks to our valued bronze sponsor, Dr. Ali Tanazli, the CEO of Lifespin GmbH, whose steadfast support and collaboration have played a crucial role in bringing this conference to life. I would love to start our first panel discussion. They are eagerly awaiting. So up first is the topic of genomic medicine, exploring the role of genomics in personalized healthcare. Our moderator for this session is Prem Iyengar, and joining him on the panel is Dr. Pedro Luis Gonzalez Sanz, Pallav Kandival, and Dr. Alexandra Filipovic. You're most welcome. Yes, your mics are on your chairs. Take a seat, and the stage is yours.
All right. Morning, everybody. Small crowd, so we hope that we make this as interactive as possible. We've got an interesting topic of discussion today, and of course, that's blended with an interesting panel also. I'd say it's one of the most diverse panels. We've got researchers, we've got practitioners, we've got entrepreneurs, and we've got technologists. So I'll start by quickly introducing myself. My name is Prem Iyengar. I lead the technology for life sciences practice across our pharma and medical devices domain at Accenture. I've been with the industry for close to about 20 years, primarily working on digital transformations, working on AI-led drug discovery, genomics, of course. It'd be incorrect of me to sit on this chair today without being involved in genomics in any way, shape, or form. And of course, I'll let the panel introduce themselves without much ado, but just to kind of give you an idea about what we're going to talk about today is, we're going to talk a little bit about where do we stand today as far as genomics and personalized medicine goes. We're going to talk a little bit about what the future holds and how do we really get there. We've got about a good 10 minutes set up at the end for question and answers, and we'd love to make this as interactive as possible. With that, over to you, Pedro.
Thank you very much, Prem. Well, my name is Pedro Luis Gonzalez. I'm a preventive medicine specialist working on personalized lifestyle medicine. And to do that, I use genomics, but not only DNA analysis, but I'm using nowadays a very precise tool, which is an mRNA analysis that is done uniquely in Europe in the Sant Pau Hospital in Barcelona. And it permits me to know which, even years of anticipation, which one of the 320 biomarkers that it analyzes may be altered or not. And this gives me precision in our lifestyle plans because it gives me a very precise idea on where I have to look for with biochemicals. No? And I think that, we will talk about the future later, but I think this is the use I'm doing to genomics.
Pallav?
Yeah. I was waiting for your permission, Mr. Moderator. So yeah, hello everyone. Pleased to see some of us here. Myself, Pallav Khandelwal. I'm a second generation entrepreneur. I've worked my entire life, which is past 20 years, into pharma, supply chain management, right from warehousing logistics to distribution to retailing. Very recently started my own genetic testing company with a couple of friends. So yes, that gets me here on this esteemed panel, and we'll be looking forward to answering most of the questions and make it as interactive as possible. Thank you so much.
And Alex, just for clarity, you guys don't need my permission. And in case you were still wondering, I'm the technologist, he's a practitioner, he's the entrepreneur, and she's the researcher. Go ahead,
Thank
Alex.
you. Good morning, everyone. Nothing like a session of genomics to wake people up at 9 o'clock in the morning, I'm sure. So thank you for choosing to be here. My name's Alexandra Filipovic. I'm a medical oncologist practicing at Imperial College in London, UK. I'm also the head of oncology at PureTech Health. So I'll be wearing both my clinician hat and my biotech entrepreneur hat as we dive into this amazing topic this morning. I'm looking forward to a lively discussion, and please, we want to invite you to be engaged, so think of any questions that you might have for us going forwards.
Absolutely. So, moving along, I think we should start a little bit with, we know personalized medicine is here to stay. It is the future. It's what we used to commonly refer to as new science, which was a combination of science and technology. What we want to start out a little bit is with, from your experiences, where do you guys think we are today with genomics and personalized medicine? Just to basically set up that stage for what we're going to talk about a little later. Alex, you want to start us off with that? You want to start us off with where do we stand today? Yeah.
Sure. I think it's really timely that we're talking about this because we're really a decade into a renaissance of genetics and genomics, and I dare say that oncology has pretty much been the poster child for how this technology and the application can bloom in various different ways. So to start us off, really, I'd like to lay the ground of what we have today and how we use it in oncology and in drug development, specific to oncology, because really that's where I live. It really penetrated our practice about 10 years ago with the birth of next-generation sequencing, and we've seen comprehensive genomic profiling enter the clinics left and right. So we know that we use it for diagnostic purposes. We use it as predictive prognostic biomarker. We also have companion diagnostic in the pipeline that we use tremendously in drug development. So we use the results of genetics and genomics testing both for prevention, for diagnosis, for guiding treatment choices, for understanding better how or if patients are going to respond to treatment. And we have numerous examples of this in oncology. It obviously started with targeted therapies, and just to name a few, in solid tumors and hematological malignancies, probably the birth of all of this came with a BCR-ABL and Gleevec as what we call the poster child for targeted therapies in oncology. Then this followed with Herceptin for HER2, EGFR targeted therapies, KRAS, BRAF, PIK3CA, RET, NTERK, FLT3, CMET, and I can go on and on. So the portfolio of targeted therapies that were birthed on the back end of the gift of genetics and genomics has really flourished in the past 10 years, and it continues to. And then in 2011, we had the first immuno-oncology therapy approved, ipilimumab, and then that followed with the renaissance of anti-PD-1s and PD-L1s. And genomics and genetics has entered that space on a high horse. So we have tests such as MSI-High, tumor mutational burden, T-cell infiltration scores, IO360, and I could go on and on listing those tests that we use in clinic and that we're learning how to use in clinic. So whichever therapeutic modality we implement in oncology, genetics and genomics are very, very present. We test tissues, we test blood. So we have somatic profiling and we have germline profiling for prevention purposes and prophylaxis. And there are certain questions that these tests are able to answer, such as who do we treat and what do we treat with? And these questions, I dare say, are answered to some extent, but not fully. And then as we have been living in this era of genetics and genomics and oncology, we've also understood that there are some questions that we would love to have answers to, but don't. And it would be an invitation for seeing how we can get there going forwards. And those questions would be, even if a patient is responding to treatment, and certainly if they're not responding, when do we stop treatment? Because more is not always more. And then when do we switch? So for oncology, I feel those questions would be really important to address.
Absolutely, and that's an interesting perspective from a researcher's front, right? What we'd like to understand from you, Pallav, how is this getting translated from a commercial standpoint, since you're so much doing the on-ground testing, so as to speak, right? How does, where are we today with that, and how are we really utilizing this to enhance patients' lives? Not necessarily patients, just human life in general.
Yeah, wonderfully put. I mean, I like to ask question from all of you, this wonderful audience. Who all would want to prevent a disease rather than cure it? Please say hi or raise your hands. Right, everybody would want to prevent. Genomics and genetic healthcare gives us that technology, that edge where we can actually work on preventive healthcare. And having been said that, back in India, we've already started doing that. Doctors have rebranded themselves as preventive cardiologists, preventive dermatologists, preventive diabetologists, using these genomic and genetic testing. Once a patient understands their risk for future, they get to decide which healthcare to pick up, which healthcare science to go forward with, because back in India, we have wonderful people here, like we had some yesterday, who are practicing alternate medicines as well, like my esteemed panel. We have allopathic medicine practitioner doctors, we have Ayurvedic doctors back in India who are actually working on preventive healthcare. So this is already here, and this is already changing how healthcare, personalized healthcare, preventive healthcare is being perceived. So I guess that answers the question.
Absolutely, and I think that's very well put. I think the crux of what you were trying to kind of say is prevention is better than cure, but I think the next stage of prevention is really prediction, right? So today we're more of reactive. We want to be more preventive, eventually veering more towards being predictive. And in that context, Pedro, you are practicing this today. What is it that you're doing today that is really using genomics towards personalized healthcare?
Well, yes, in reality, scientific wellness is a concept that was created maybe 15, 20 years ago, although it didn't have the resound it should, because we didn't have the technology at that moment. You know? But I think that genomics, it's a very important field, and precisely today has been published in Nature, a US study, where they finally have concluded that at least there are 10 polygenic risk scores that are validated, taking into account the ancestrals and also the follow-up of the people. No? And this means that as physicians, we can create a good environment for our patients, explaining them that they have to do something about, no? But this is where I join my scientific precision with the holistic view, no? Because we live in an environment and in a world that is not ready for us to prevent, no? It is, all of them want to prevent illnesses, but it's very difficult because we don't have the food that we need, we don't have the lifestyle we need. Today, not everybody is here, but I think that they have done well because we are not ready to get up at 7 a.m. and have our cortisol level up during all morning. No? And we are just built up to have our cortisol level to get up and then steady in a low increase, go up until mid-morning. No? So this is something that we'll have to think also as a society, no? How we want to organize ourselves to be able to make use of all these advancements.
Absolutely, wonderful point. And just to bring the technology view into it, because I just can't seem to shut up about it. One of the things that happened during the pandemic was that the rate of dropout during clinical trials drastically dropped. It was huge. So while we are pushing pharmaceutical organizations to be more innovative, be able to get drugs out faster into the market, they can do that only if they have the right set of patients to run their clinical trials. And this is where I think genomics plays a very large role, to be able to proactively identify patients for clinical trials. So rather than look at a drug and say, okay, now I need 500 people to do this, rather 5,000 people to be precise. You can proactively identify through genomics, through tests such as yours, to figure out, here is a possible sample set of people that can be included in trials, whether that be oncology trials, whether that be Parkinson's, whether that be Alzheimer's. And cell and gene therapy essentially gives us the opportunity to be able to look at diseases that we today think that are truly incurable, right? The possibilities are enormous, and I think genomics has the answers to it to quite a large extent. We're just at the tip of the iceberg right now. We're just basically scratching the surface. And technology is there to kind of push that forward, whether we talk about AI. AI-led drug discovery has taken a significant turn with most pharmaceutical organizations investing very, very heavily in AI-led discovery. And the chat GPTs of the world have just enhanced that even further. But then pivoting more towards, so these are all here to stay. I think we agree upon that as a group. But what do we see as the future? And Peter, I'd like to start that with you. What do we see the future? How do we kind of marry genomics to personalized medicine? What's really the art of the possible? And this is where we'd like this to be as free-flowing as possible, because we're talking art of the possible here, right? Let's be a little controversial if possible. Go ahead.
Well, the future, I think it's bright. But again, we have to make thinking, deep thinking as a society, because what we need first is to validate all this. Just now I have mentioned this study that has finally validated 10 polygenic risk scores. But we know that there are a lot of companies, especially in the US and the Western countries, that they are doing risk scores based on DNA analysis since maybe 20 years ago, and they are not validated. Yeah. So the first thing we have to do is to get as many people as possible to have their DNA tested. And this means assure them their privacy and their right to own the data. This is by one way. And the other thing is that we have to use artificial intelligence as much as possible. The mRNA analysis I use is based on artificial intelligence. If not, it is impossible to create profiles based on the polygenic expression of the genes and the mRNA they produce and the disease that they are based on. So I think that we have to make an effort as a whole society, to be able to see the human being not as I would say a robot, that is composed of different parts, as by now is still the mainstream thinking in medical science, but to see human being as a conjunct of biology systems that are interconnected, interrelated, and transmitting a lot of information every second, and so be able to have all this data from inside and transform it in something that is actionable.
Absolutely, and I think that's an interesting point, right? It's all about the data. There's ridiculous amounts of data. Right? How do you really make sense out of it? I think that's the answer that we're looking for. How do you really make sense out of the data? To your point, AI will help, but AI, again, will help. Somebody has got to put their minds to it to really figure out what should be that algorithm. How does the algorithm interpret the data, right? And so, Alex, the question is more to you as a researcher. How do you think researchers should be thinking about this in terms of making sense out of the data? And then afterwards, Pallav, what I would like to hear from you is, while the researchers are going to give you that insight, right? How do you make it more commercially viable, and how do you really, I think another key part is to spread the word, right, for the lack of a better term. How do you really go about doing that?
So I'd like to put forward really a short answer and then I'll elaborate. I see the answer to this being two words, and those are integration and openness. And what I mean when I say that is integration really means getting out of our silos. So if you think about oncology, both in terms of clinical practice and clinical development of novel therapies, we are a little bit siloed still. And we've heard these amazing applications of genomics, personalized healthcare, prevention, lifestyle genomics. So when a patient walks into our oncology clinic, I would like to invite us to look at them as a whole and not as a tumor. So if we could understand that perhaps they're experiencing this condition at this given point in time, they are a whole person. So we need to start collaborating and integrating all of these beautiful offerings that we have today that genomics gives us. And then I really feel that AI is going to tremendously help us make sense out of the data so that we can go back to being human. That's integration. And what I mean when I say openness, it's really willingness, if you would. It's our willingness to be open and to accept and embrace what technology and genomics are giving us, and not to think that our role as a clinician or as a drug developer is going to be somehow taken away from us, because it's not. It actually is going to be repurposed to what it was meant to be all along.
And that's an interesting point, right? I think it's very important to understand AI is not to replace, or technology in general is not expected to replace, but to help augment human capabilities. AI can do what you ask it to do. Yes, it can self-learn, etc., but that again is dependent on what you want it to learn. It's not going to be able to cure. It's going to be able to tell you, here are the possibilities. So we need to your point, have an open mind around it, right? And so, Pallav, how do you think that really translates to from a commercial standpoint? How do you scale it up, really?
Oh, as an entrepreneur, this rings bells, you know? So I'll just throw in some numbers. The genomic service market in 2023, just the genomic service market and not the associated market that comes along with it, was 46.2 billion around, you know? It had jumped 3 times from 22. So imagine how big it'll be in coming 5 years. Now what AI does, and we need to embrace, we have to embrace genomic testing, genomic healthcare. This is what all countries and all healthcare service providers should do. And that's how we will move forward and make it commercially viable. As we keep embracing it, make it available for all of them, the scale of economies go down, and people from the lower income group can also afford it. And doctors can start prescribing it. The reason I say that is, let's take example of Dubai, where we are sitting, such a wonderful country. They have an AI minister. They have a ministry for AI. They have already made the company that I come from, my DNA testing kit, as medical devices. They've certified it. So see, countries are already embracing it, trying to bring it in the mainstream healthcare practice. So it's like AI. Either you embrace it, or you can, start to say that it's a demon. But it is here. Let's embrace genomic medicine. Let's embrace them into our, regular practice. And I'm sure it'll give you tremendous outputs. And like Alex said, we'll be humans again. Yeah.
We'd be humans again. That's
Very controversial, and we had discussed this last.
and thanks for that. And I'm hoping that elicits a few questions from the audience. So interesting conversations. Pivot a little bit, right? So yes, we know what genomics can do. We know what our AI can do, right? The million-dollar question always is, okay, but how, right? Of course, the technologists will say, tell us what needs to be done. We'll build it for you. But then how do you really go about this, right? One of the things is we talk about, to your point, right? We really talk about silos. But is silos really something that's going to help, or do we need to really look beyond those silos, right? We need to start looking at things from a more holistic perspective, because that's what genomics can really tell us. It can tell us an individual's capabilities. Where does that individual stand from a genetics perspective? What is that individual predisposed to? So how do you think we should be going forward with this whole topic of merging genomics with personalized medication? Pedro, you want to?
Well, it is very important to remind that genetics is not something that is static. It's a dynamic thing. As a biology system. And the environment and also our inner mind changes our epigenome every other second. And from this point of view, with AI and genomics and all the technological advances, you have a very good tool to know what is happening. But then how to act upon this remains on the side of the person, no? Your client or patient or whatever you want to call them. No? And the thing is that, for example, in my practice, I can be very precise, providing my clients with a personalized nutrition plan, a mobility plan, a recovery, and all this stuff. You know? But the main thing we work on is their attitude, their emotional attitude, and their upon them and their life. Because if they don't begin to give a priority, and they understand that all they can do is in their hands, they're not going to do it. This is why all preventive public health plans and lifestyle plans by now are failing, because people cannot change the way they have been built up.
Absolutely. And we're talking massive change here, right? We're not talking about changing just the laws. We're talking about a change in the way people think. So Alex, question to you, right? How do we really go about that from a researcher's standpoint? How do we really propagate the thought process around, let's not look at it from a silos perspective, let's look at it holistically? How do we kind of make sure that any treatment, or rather any innovation that we really bring about really takes into consideration a holistic view into things? Obviously, it's a lot easier said than done. But then we're still talking art of the possible, right? So why not?
Yes, it's really this concept of holistic genomics. And it incorporates the integration and getting out of our silos that I mentioned earlier. So what could that look like? Let's say from a research standpoint, we now have so many incredible pharmaceutical and biotech companies who are developing new drugs, and really we're seeing paradigms shifting in terms of the modalities that we have at our disposal to treat diseases. So notice that I'm not saying disease, I'm saying dis-ease, right? So shifting our mindset around some of the narrative that we use will be super helpful as well as we go about this. And we have clinical trials, and we say the trial has succeeded or the trial has failed. The drug works or the drug doesn't work. Well, if we take a step back and we really zoom out for a moment, within every clinical trial, there are patients who have responded to the treatment and then those that haven't. But we tend to look at these clinical trials as singular entities. And I understand also from talking to you yesterday that there's an incredible initiative now to step out of that model and to really integrate that concept as well, because my bet is, I mean, we're humans, we're more similar than we are not. And my bet is that if we start pulling the data together, because we sit on so much data in isolation, if we only were to pull it, not even just in one medical area, not just in oncology, but pull it perhaps across autoimmune disease, inflammatory disease, oncology. Pull the trials together and see the common thread between patients that haven't done so well and those that have. And let's see what happens there and where does that guide us. So as much as we have tools today that simplify things a lot, I think that our minds tend to overcomplicate it. And the answer is probably simpler than we think it is. So again, integrate and be open. Be open to look at the data in their totality.
Absolutely. And again, right? So, of course, please.
Because it's very good that you're telling this, because I have remembered now the fact that among the most sold drugs in the US, for example, the 8 ones, the one that has more efficacy in their target population has 20%. So we have to rethink about our model and how we are confronting the fact of health and disease.
Makes absolute sense, right? And when we really talk about breaking the silos, when we talk about looking at it holistically, right? I think that gives us another insight, and that's around the efficacy, the side effects, in a much more precise manner, for the lack of a better term, right? So I'm looking at comorbidities from the data itself, even before I really get into the administration of the drug itself. So which means that I have really gone predictive, for the lack of a better term. So Pallav, again, coming back to, and I think your contribution is more around being able to scale this, right? Because ultimately, at the end of the day, if it's not scalable, it's pointless. So your thoughts around the scalability piece?
Yes, absolutely. And see, this goes hand in hand, the research, the scalability, the economics, and how we can integrate. Because until and unless genomic testing, genetic testing is accepted, we won't have that data. If we won't have that data, we won't be able to use AI to interpret the data, make sense out of it, segregate it, use it for different purposes. So it comes back. See, all of this goes hand in hand. I mean, the point of this being accepted as commercial as possible, included in day-to-day healthcare practices. I'll share some examples. The Chinese government had made it compulsory for their Winter Olympic team to go through genetic screening. A lot of sports institutes in India and abroad are doing it, already using it for injury prevention, for nutrition, for diet, for performance enhancement. So yeah, of course, this has to be done in an ethical way. But then again, as soon as we start incorporating it, and that's where we come into picture. Like, we've started training our healthcare practitioners along with passing information about something of this sort is available and is very economical. The days are past when this was very, very heavy on pocket. It is very economically available. It's just that we have to start teaching ourselves to use this, as we are doing for AI or for other applications for that matter. So yes, this has to go hand in hand.
Absolutely. And with that, I think we're at a 2-minute warning. So just to kind of sort of conclude, right? The data exists. We need to make sense out of it. We need to keep a more open mind about how do we bring all of this together. And then finally, incorporate it literally in our day-to-day lives. And the technology is available to augment all of this. that's my conclusion out of it. And I'd like to hear from the audience if they have any questions or any comments on this topic. Yeah, please go ahead.
Can we have that mic operating, please? Or you can.
It's working? Hello.
Yeah.
Great. Hi, I'm Kunal from Bombay. Very nicely said, madam. When a patient comes, right, we are not only checking one part, we are checking the whole. What is the emotional state? And Mr. said, its genetics are not only static, it is dynamic. Beautifully said. Now, my question is here, because I'm in the line of training from the last 30 years, and I have seen a lot of business clients are getting heart attack, okay? Especially CEOs, they run marathons, okay? In the morning time, they get a lot of heart attacks, injuries. Many people are getting autoimmune conditions. Now, my question is simple, as simple as it is, how genomics, okay, and stem cells, they connect, because the stem cells can become any cell, all right? If a person is getting heart attack, can we replace stem cells and with the genomics to create a new heart and to repair it or reverse the autoimmune condition? How it will connect? Because I'm a lame person here. Please help me, because I want to understand in a deeper way, so that I can suggest this technology to my clients, my patients, you know. I'm not master of your line.
So I'll take the first part of it.
Yes.
The researchers and the doctors can pull in later. So let's try and prevent it
Okay.
from happening, and let's not try and replace the heart and make a new heart, but let's prevent it from happening, and there are various tools to do that. So when we enter into the genomic healthcare specter, genetic testing specter, we get so much information. We already have predispositions of that person, whether he'll have that cardiac condition or not. Not just that, we have information such as whether exercises increase someone's blood pressure or it decreases.
Exactly.
Everybody works in a different. So once you know as a trainer what exercises does to that person, you'll make a plan, an exercise plan, specifically according to his body. That gives you that edge.
Right.
What supplements to take, what exercises to follow, all of that. So many informations. I mean, you can tailor-make, that's why that precision medicine, precision healthcare, you can tailor-make regimen plans according to an individual, and it will be amazing. He'll start feeling amazing from day one.
And I can vouch for that. That's coming from a national level basketball player.
This is the preventive measure, right? But if somebody already got the heart attack, I'm talking about, because the stress level is so high in the business, in the family, I'm talking about emotional stress, which is a killer, which can create cancer, tumor, any kind of metabolic conditions. So I'm talking about how this technology is gonna help to, is it possible to reverse, to heal that heart? If that person is on medications of 12 medications or 13 medications every day to pump the heart, to run the show, can we reverse it through this technology? Is it possible? I just want to know that.
I can take the first stab at it, yes. So I'm not sure whether I can give you an answer that puts genomics at the center of it. I think genomics could be a part of it,
Okay.
but I don't believe it could be the whole answer. That said, my answer to your question is yes.
Okay.
It can be done, and it
Wow.
potentially could be reversed. And how do we do it? This is where we get into, it's a multi-layered approach. And what that means is that you mentioned their lifestyle is stressful. You've mentioned, I heard you say emotional component. This is where we go for. And I hope that, and there may be something out there already, and I would love to know if there is, I hope that there is going to be a genomics tool as well that we can hold its hand and that can help guide us through this. But it really becomes that humanized approach. It becomes the point of addressing the stress and the emotional underpinnings of it and the reasons behind it, the why behind it. I don't think that genomics today can answer the why,
Right.
which is why we need to get back to being human as trainers, as physicians, as
Yes.
facilitators of this, as holders of that space for healing. So I think genomics is hugely important there. Prevention is hugely important. I think all of that goes together and you get to incorporate that, and that's beautiful. Chrononutrition, that's very personalized. Asking the question, who else lives here? What does that mean?
I got it.
Gut microbiome, right?
Got it. Yeah.
Genomics of
gut
that.
brain axis.
How do we get to optimize that?
Yeah.
So that's that holistic genomics. And then there's that personal touch that's going to beautifully address the stress and the emotional component. And together, you're going to see that condition reverse, if it's meant for that person.
Thank you. Thank you so
They
much.
have to make a choice as well.
Thank you. Thank you.
Yeah.
Sure, I think we've got one more question. And go ahead.
Hello. Thank you for this great contribution about genomic and genetics. So my question is in the field of prevention that we talked about. When we look at health challenges, a general rule is that health challenges are multifactorial. We have predisposing elements and trigger factors that activate those predisposing and predispositions that each and every human being has, because we all have some. From research today, we know that the field of genomic and genetics belongs more to the predisposing section more than the trigger itself. So my question is, where is the ethic, and if in the field of the expertise, how do you see the boundaries between carrying and performing some testing to make preventions, so, and almost giving to people that are healthy, giving them an information that they might develop a certain type of disease, when we know, as you said, sir, that our brain is actually much stronger than our genes themselves, because we can actually have a much greater influence. So our mind and getting to know that we have a certain type of genomic predisposition that by itself would never be able alone to trigger the development of the disease. How do you actually plan to control in an ethical way the prevention and not allowing this information for people to be the actual trigger, and to see this tool as something positive for the future and not something that behaves as a boomerang and that becomes a trigger itself? Because if we would carry genomic and genetic tests on all the people in this room, we would all show up some kind of predisposition to develop certain type of disease, certain type of imbalances, and so on. So where does the ethic of the companies that are developing this for the future? Thank you.
Well, it's very interesting because this is something that I have worked on. Well, nowadays we are at the dawning of all this. No? We are very excited about genomics, but indeed it's in the beginnings. And as I said before, just now today have been published a study that finally detects as valid only 10 polyrisk scores. And one could ask ourselves, do I have the right to tell this person that has an X risk of cardiovascular or cancer disease? Nowadays, for example, what I do is just to make an analysis of how they are doing at this time with their lifestyle, in the environment they live, how they live, and then we work on this, but not on risks. Because working on risks, it's something that unless you have a clear intervention to reduce or annihilate this risk, it's no way. Either way, they are going to have to make lifestyle changes. So it's just something. But if you think, this is said from my clinical point of view, but if you think as a human point of view, I think I have the right to know. And this
Also,
is something that should be left to the people, no? But I think that the right to know is something that we have to preserve always.
yeah, also, I mean, when we incorporated this, how we did it, it is very important. This is very important because stress is the biggest trigger factor known forever, you know, and somebody has predispositions and they get stressed out about it. So what we've made is we only work with counselors. So the information routes through medical practitioners, trainers, sporting authorities, you know, and so you bringing back the human touch, you know. So how do we give out bad information to somebody? We do it through counselors. So if we have a bad information to pass on in a hospital, how do we do it? We have to do it. So we do it as a human. So once, because it closes the loop, because the practitioner, the trainer, they also have the solution for it. So it's not just giving out stressful information that you might have this, you have this, but he's also giving out the solution for it. So I believe that brings down the stress and give out actual solutions to patients.
Yeah, is it okay if I briefly address that? I absolutely love your question. And the reason why I love it, I'm gonna give you two visuals for everyone in the audience. One is, imagine that the condition or the disease is a house that's burning, and there is a fire alarm that's going off to tell you that that's happening. The fire brigade comes and points the hose at the fire alarm and not at the burning house. This is really how we're addressing conditions, many of them today. We're pointing the hose at the fire alarm and not at the actual house. So we're not going down to the root cause. And this is where I believe that, in part, genomics and genetics can help. And the other part of this is what you've brought up in your question. Do I want to know? Are you offering me the solution? What is the right time? And I feel that one piece of the answer there is education. And it's also re-empowering the patient back. Because they have, I feel, given too much power to us as physicians. And I think it's time now for us to give their power back to them, because every single one of us is really the CEO of our own health. And I think that needs to be a reframe going forwards that puts the power back where it belongs, so that we harness sovereignty and discernment when we make our health decisions for ourselves. And then not every condition can be even addressed by genetics and genomics. It really can't. There's only a handful of diseases that warrant proper genetic treatment, and we thankfully have those available now, and more will come. But here's something just for the sake of discussion as I wrap this up. Think of our genes as a library, as books in the library. You walk into a library and the books are sitting on the shelf. Unless you pick the book up and read it, it's not going to read itself. So you need something to read your genes. And there's that layer that floats above our genome that we call epigenetics. And there's something to be said about how our daily living influences our epigenetics, and therefore the expression and the interaction of our genes, and how then that translates into what we're experiencing on a physical level. So I feel that we are not only going to be going forwards integrating aspects of genetics and genomics, but we're also going to be collaborating with epigenetics, with metabolomics, to make that holistic view.
Absolutely, and I love that point Alex made. You are the CEOs of your own body, right? With that in mind, please don't run to the CXO 2.0 conference. On that note, thank you very much, everybody. We're significantly over time, and I apologize for that. But I think interesting questions, fantastic conversations. Love the interaction, and hope to do this soon again. So thank you, everybody.
everyone.
Thank you so much. Thank you.
Thank you so much to our experts. All I'm going to do is ask you to take a step to the front of the stage so we can get a lovely photograph of you all. Yes, put your best smiles on. And I see the room has filled up nicely, so good morning to you all and welcome to day 2 of the Health 2.0 conference. For those of you who don't know me, my name is Maxine, and I will be your host and your guide for the entire conference. Up next, we have Ariba Khan. She is the CEO and founder of Jumping Minds. Now, she does have a very short presentation that she'd like to chat to you about, and the topic is Next Gen Mental Health Platform. Thank you so much, panelists. Thank you. And if you could all give Ms. Ariba a round of applause.